Okay, so today it's a short class or lecture on AV blocks for your CBT 2330. Or if you're just visiting, you're curious about AV blocks, welcome. Okay, so there are 4 types of AV blocks. There are several types of blocks in the electrical conduction system of the heart. We are going to focus on the atrioventricular blocks. So if there's any block between the atria and the ventricle. So these are the 4 that we are going to study and go over today. We're going to have first degree AV block. So I'm going to skip the AV block because they're all AV blocks. So it's first degree, second degree. Second degree block is also called Mobitz 1 or Winky back. However you want to call them, the 3 are going to be identifiable. Now, the most common name for this block is Winky back. And then we have second degree Mobitz 2, or we can just call it Mobitz 2. And then the third degree block. Let's take a look at some of the characteristics of each one of them. I made it very simple. You can go back and read chapter 4 of your book. This is where the blocks are. I like to focus on the most important so you can study and recognize and make the decision when you're looking at the strips. For first degree block, we do have, let me see, there you go. For first degree block, AV block, the characteristic that we have is the PR interval is going to be longer than 0.2 seconds. We already went over the small squares, the large squares. So 0.2 seconds is going to be 5 little squares or 1 large square. So this is really easy to identify because we can just go look into the larger blocks. If your PR interval, which is, let's go on this here. So the beginning of the P to the beginning of the QRS, if the distance is longer than 1 large square, that could be a condition for a first degree block. Another characteristic is this rhythm is regular. We're going to see it. Every beat is going to look exactly the same. So if we have our calipers and we go measure the beginning of the next beat, beginning of the P wave to the beginning of the QRS is going to measure exactly the same on every beat. So it's constant, it's rhythmic. But the point here, the characteristics is the PR interval is going to be prolonged because it needs to be in a normal hard or normal conduction less than 0.20 seconds. So just the fact that it's rhythmic and the PR interval is longer than 0.2, that is going to be identifiable or identified as a first degree block. Second degree has. So let's make just a notice on first degree, the P's and the QRSs are there. We don't miss anything. They never drop. It's continuous. Typically, we don't do, there's no intervention for first degree. So it keeps, there's no absence of any conduction. It's just delayed. Now, on second degree, there are drops. We are missing, as you can see here, we are missing QRSs on both. So that's why they both qualify for a second degree. The difference between the two is going to be, let's take a look at Winky back first. Second degree or Mobitz 1 or Winky back, like we said, Winky back is the most common name. One of the characteristics is the PR interval is going to get longer and longer. So if we take the PR interval, beginning of the P to the beginning of the QRS, and then we move to the next one, beginning of the P, beginning of the QRS, and we can already see that it's already, there's a little bit longer. We go on to the next one, and this PR interval is way longer than the one before, and then we notice the absence of the QRS. And then it restarts. So if we look at this one, we're going to come back to the first QRS complex that we have here, or the P and the QRS complex that we have here. So the characteristics of this particular, or Winky back, we can say, we can identify it, PR interval gets longer, 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 and drops. Longer, 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 drops. This is very important. The QRS is still good, less than 3 little squares, which is less than 0.12 seconds. Everything else looks good. It's just odd that you're gonna identify right away that it's missing a QRS when you first take a look at your strip. And then you're gonna take a look at the second piece of information that you have when we interpreting EKGs. We're going to observe there's P waves, they're upright, and then we're going to look at the PR interval. In this case, we're going to notice right away that the PR interval gets longer and longer. And then the QRS drops. So there's no conduction between the atria and the ventricle. So that's an AB block. All right, so let's take a look at MOVITS 2 or second degree AB block. As we said before, just like the one before is missing a QRS, just looking at the strip right off the bat. Now, the difference between MOVITS 1 and MOVITS 2 is that the PR interval, it is not longer on MOVITS 2. If we look at this strip, it is actually the same one on every complex here. P QRS complex, the PR interval remains the same. It does not get longer. It does not modify. It's the same across all the beats. Now QRS, it's a little bit wider than 0.12, slightly wider. And then I'm going to go ahead and see that I am missing a QRS. So the QRS, the ventricle is not getting the signal from the atria. So we are going to call this drop. And therefore, in MOVITS 2, all of a sudden, there's a drop. QRS is a little wider, and those are the two characteristics on MOVITS 2. So both second degree, the QRS, there's a drop in QRS, and then we want to identify. If we want to figure it out which one is it, MOVITS 1 or MOVITS 2, we're going to take a look at the PR interval. If it increases, prolongs on every beat, and then the QRS drops, then is Winky back or MOVITS 2 or second degree type 1. MOVITS 2, the PR interval is good. It's not longer than 5 squares, little 5 squares, or 0.20 seconds. And then all of a sudden we have a drop on QRS, and then the QRSs that are on the strip are just a little bit wider. And then we have the third degree AB block. The characteristics on this third degree block, when we look at a strip, it looks odd. Just looking at it is kind of okay, but kind of not. The first thing that we're going to see is going back at the first steps. We're going to see what kind of rhythm is this. We're going to identify the heart rate. Can we identify P waves? So there are P waves, yes. And then is the P wave upright? Yes. And then is there a P wave for a QRS before the QRS? So we're going to look at this here. There's a P, but then there's no QRS. And then here, it's kind of tricky because the P wave is this one, but then there's no QRS. And then this one is a P wave, and then there's a QRS, and then here. So it is all over the place. However, within this nonsense, when you look at it, if we take our calipers, what we can do is, the problem here is the atria and the ventricle does not connect at all. Well, in the MOVITS 1 and 2, the QRS drops and then restarts. In this case, they don't talk to each other. There's no connection. There is a disconnection. Therefore, the ventricle having the automaticity and the conductivity characteristics, they fire on their own. So therefore, when we look at this strip, there is some order, even though we at first sight we don't see it. So what we're going to go ahead and do is locate the R's. So we're going to measure RR, and then you're going to move your calipers and move to the third R. So it is going to be the same distance from the front R to R to the second R to R. And if we look at the entire 6-second strip, we're going to be able to see a little bit more the synchrony of the ventricle. So the ventricle is going to be firing with rhythm. The second notice that we're going to do is P waves. So if I measure P waves, they're all going to be matching at the same time. So if I take my calipers, P waves are also happening at the same time. If I use my calipers, so that means the atria keeps firing on time, its own rhythm, and then the ventricle's firing at a separate rhythm. So as you can imagine, one of the problems will be, those ventricles are going to be filling, and then there's no response on their fire, so they fire whenever they can. So this particular rhythm is lethal. So when we see this rhythm, and also another thing that you can see here, the heart rate is very low. And so it's in second degree, it goes low, second degree type 2, so it slows down a little bit. Okay, so first degree PR interval is longer than regular or longer than normal, longer than 0.20, but it does have the rhythm. It is firing at the same distance, and we can see that there is regular form. Second degree Mobitz 1 or Winky back, PR interval is going to get longer until it drops, and then it restarts longer, drops. And then second degree Mobitz 2, my PR interval is going to be the same across the board, and all of a sudden QRS drops. And then in second degree and third degree AB block, we are going to see slow down of the heart rate, the inconsistency between the ventricle and the atria. There's not a QRS for every P wave, and there's no P wave for every QRS. So they are just not talking to each other, but you should be able to identify the rhythm of the ventricle and the rhythm of the atria. So it will be regular among the ventricle, and it will be regular among the atria. So those are going to be the characteristics here. Okay, let's take a look at let me see here. Okay, here. This is another sample, and I like this from osmosis.org. They do have represented they're representing the PR interval. So we can see the difference between, especially the second degrees. So we're going to see here Mobitz 1 or Winky back and Mobitz 2. So you can see the difference between the two. On the top strip, we do have a regular or a healthy, they call it here, a healthy EKG. And then we have a sample Mobitz 1 and Mobitz 2. On Mobitz 1 or Winky back, we did say that the delay is going to happen progressively with every beat. And we can see here the representation of this yellow area. This is what is going to show the lengthening of the PR interval until we no longer see the PR interval, and then there's a drop on the QRS. And then after this, it will more likely restart all over again, going to this beat. So P wave is generally consistent across the board, and then just the lengthening of the PR interval is going to give away that is a Winky back block. And then on Mobitz 2, we can see here on this particular sample, let's go on to the second complex here, or the the third beat actually. So we're going to see the P wave, the PR interval, or the segment in this case in the yellow, and it's going to be across the board. Look at all of them. They are exactly the same. They have the same time. They're not getting longer. They are exactly the same. However, there is a drop on the QRS. So if this were to start, look at this. So we have a regular PR interval, QRS a little bit wider, and then we have a T wave, and then we have a little U wave in there. But then we move back to the P wave QRS with this regular interval, and then we have the T, the U, and then there's another drop. So that means here, for every 3 P waves, there's a drop on the QRS. So I hope that one makes a little bit more sense. This image. So show you the next slide is a third degree AB block. So I think it's the one that kind of is difficult to interpret because it does look at, when we just look at it quickly, it does look a regular rhythm, right? Because we are typically, what we do is we take the R's to see if a rhythm is regular or irregular. But something looks odd, right? It doesn't make sense because it's not really a PR interval problem. This PR interval looks here, but then there's another P, and then this PR interval doesn't make sense. And then this one is a little longer like the first one, and then this one is shorter, but not as long as the others. So this is when things don't make sense, let's go ahead and immediately test or apply the rules for third degree. So here with the blue markers, we do have the P's marked, and we find that they are on time, they are regular, but they don't match with the ventricles. So just that alone, that don't match the ventricles, will take us to the third degree block because ventricle is pacing on its own, and then the atrius is pacing separately. Again, remember, this is a medical emergency. This patient will end up with a pacemaker as soon as possible. Let's practice. Okay, so in this practice, thanks to Dikimedics, we do have, let's see if we can figure it out. I like this image because they are helping us a little bit, giving us some information. And this is what we should be practicing to do as we keep seeing more strips. So just looking at it, I can see that there are some dropped QRSs. Okay, so that's one thing to look at. What is the second thing that I have to do? I'm going to go ahead and look at my P waves. Are there P waves? Yes, there are P waves. Are there upright? Yes, they are upright. Now, let's take a look at the PR interval, which is our next cue. So the P wave is going to start here and is going to end here, which is going to make 1, 2, 3, 4 little squares. And if you remember, our PR interval should be less than 0.2 or less than 5 squares. That's the first thing that we can put on our note. And then we're going to look at our QRS, that it's a little bit, just a smidge, almost a normal. So we're going to investigate a little bit more. So what we can determine from here is we are dropping a QRS. My PR interval is not getting longer. There's a P wave for every QRS, and then except when it drops. So therefore, I can say it is not a first degree because the first degree, the QRSs do not drop. In third degree, the QRSs do not drop. So therefore, my two choices are second degree type 1 or second degree type 2. But then going back up the information that I gathered, my PR interval is constant across the board. So therefore, this is going to be a second degree type 2 or Morbitz 2. Let's take another sample. Okay, on this image, we're going to go back to what we know. We're going to take a look at the R's. Like, it's a little bit hard to determine, but you can use your calipers or you can use your paper. But there's no drop of QRSs. I'm going to go back to my strip and I'm going to see the P wave, QRS, T wave, and don't look at anything else right now. We're just focusing on blocks. Okay. And I'm going to see the next one is going to be, I have the P, I have the QRS, and I think I have all the elements for my strip. Okay, so one thing that I can notice is I'm going to go ahead and get my calipers, and I'm going to mark the beginning of the P wave to the beginning of the QRS. And I can already see that is 6 little squares. I'm going to go on to the next one, and I'm going to find that is also 6. I'm going to go to the next one, and this one is also 6. And I'm going to go to the next one, and it's also 6. Okay, so if I have a strip in which I'm not missing any QRSs, so it cannot be second degree, because in second degree, my QRSs disappear, correct? So it could be first degree or third degree. Now, to rule out third degree, I will say that for every P wave, there's a QRS on this strip. So therefore, I need to rule out third degree because there is communication between the atria and the ventricles on every beat, regardless of the heart rate. So we're gonna leave it like that. I'm gonna give you another sample. Oh, there you go. I went a little too far. There you go. Let's take a look at another one. And you have to remember, every EKG is going to look different. Our patients are breathing, they're moving, there's artifact, there's all kind of things, but there's certain elements that we should be able to recognize. Okay, so we're gonna start just like we started before. I can take a look at the heart rate, and it looks, more or less okay, right? So it's 300, 150, 100, and before it gets to 75. So it's about 80, I will say, somewhere like that, which falls into normal. The next part of my recognition, EKG recognition, will be P waves. Are there P waves? Yes. Are they upright? Yes. Is there a P wave before every QRS? So let me see, P wave, QRS, P wave, QRS, P wave, QRS, P wave, QRS. So there is not a drop. I'm not missing any elements on this particular strip. So therefore, it can only be, if there's no drops, it can be third degree or first degree. Now, I can see this rhythm very organized. It's not chaotic. Just for that, I am going to dismiss the possibility to be third degree because there is communication between the atria and the ventricle, P wave, QRS, P wave, QRS. Now, the one thing that I can recognize here is the length of the PR interval. Look at this here, and then here. It's about 6 also. I'm gonna start here, I'm gonna start here. So all of them are exactly the same, about 6. 6 little squares that will represent 0.24, which will be over my 0.20 that needs to be normal. So therefore, on both cases, I can just see that the problem is that the PR interval is longer. Therefore, it'll qualify for first degree AV block. Okay, I have another sample. Oh, let me for that erase all my beautiful notes so we can see a little bit here. Okay, let's take a look. What can we see here? This is a full strip. This is a lot of seconds, but it is the same as lead 2 as we can see here at the top, right? It's lead 2. So let's pick just the strip on the bottom, right? The first thing that I'm going to see is I'm going to try to find the heart rate. Now, we have been using RR to recognize the heart rate. So let's go ahead and use RR, right? So it's going to be 300, 150, 100, 75, 60, and it goes under. So that means this patient is bradycardic, but it looks like every QRS is about the same distance. If I get my calipers, I'm going to find out that it is all the QRSs exist. Okay. The next step on the recognition is, are there P waves? And then I can see, yes, P wave, P wave, P wave, P wave. This one should keep it away because there's 2 P waves, kind of like next to each other. P wave, P wave. So I'm going to go ahead and recognize all the P waves that are on my strip. Let me just erase this because this is very chaotic. However, I can see that there is certain pace to this. All the QRSs are there. So therefore, I'm going to dismiss type 2, both of them, because one of the rules is the QRS drops. So in this case, my QRSs are there. And I have P waves also, but I cannot recognize longer PR intervals because they don't make sense. Look at this one, like from here to here. Well, like here to here. And that will give us a cue that between first degree and third degree, this strip that I'm looking at will be third degree AB block. QRSs are there. So you have two options, drop QRS or not dropping a QRS. There is just not communication between the atria and the ventricle. Okay. I have one more sample. Okay, on this one, remember, depending on the lead that I'm looking at, in this case, I'm looking at V1, and if you remember how the presentation is going to be, but this is still a QRS, okay? Okay, so the first thing that I'm going to do is it regular, where it looks like something is missing here. And then I'm going to go to my QRSs, and of course, it's missing. The next thing is I'm going to go to my P waves. So my P wave is going to be here. My P wave is going to be here. My P wave is going to be here. So is there a QRS for every P wave? So P wave QRS, P wave QRS, P wave QRS, P wave, no QRS, and then P wave QRS. So therefore, if there's a drop of QRS, I need to go back to what the possibilities are. It cannot be type 1, and it cannot be, it cannot be first degree, or it cannot be third degree, because only second degree drop the QRS. Now, which one is it? So I need to find out what is happening here. So what I'm gonna go ahead and measure my PR interval, because this is gonna give it away. If it's Winky back or Mobitz 1, the PR interval is going to be prolonged and prolonged until it drops. If it's Mobitz 2, my PR interval is going to be across the board the same. Okay, so if I grab my calipers, I'm gonna get this, and then I'm gonna take my calipers, and I can already notice that is a little bit longer. And then on this one, I'm gonna see that is even longer. This PR interval is even longer than the first one and longer than the second one. And then there's a drop. So this one sounds like longer drop, correct? Let's take a look at the next sample. This one is already marked for us. There's, again, if we did not have these marks, we're going to go ahead and see the QRSs. What kind of rhythm is it? We can immediately see that there is a drop on QRS. So therefore, it's going to lead us back to two options: Mobitz 1 or Mobitz 2, or Winky back or Mobitz 2. Knowing that in PR interval, knowing the PR interval lengthens on Winky back, and it is the same on Mobitz 2, I'm going to make a decision here, because just looking at these lines right here, longer, and then it drops. So if this will give it away, we're going to end up with second degree AB block type 1, Mobitz 1, or Winky back. Remember, all these names go to the same. Okay. I do have, now, when we have patients with AB blocks, one of the therapies that we can do will be pacemakers. Let me see if I can get out of this real quick. Okay. We're going to do pacemakers, and there is a few things that, this is called the MBG code. This is a combination of the organizations that created the code, North America and the British group, and they put it together, because we need to have this somehow organized. Now, depending on what we're doing on the heart, depending on the pacemaker that we are doing, we are going to do 1 lead, 2 leads, etc. So the MBG code is going to tell us what is the pacemaker doing in this patient. I don't know if you've already seen the pacemaker cases, and you can see the reps they're programming to respond to certain stimulus. Now, to read the code, you can just see, and when you read the code, you're going to be able to see what is the pacemaker doing for these patients. So the position is going to be 1 through 5. 1 through 4, and then 5 we don't really use it, so 1 through 4. Now, the first position, say we have a let me see if I can type here. Yes, I can. Okay, so say I have a pacemaker that has an A, O, let me see, A, O, O. So in this case, it means that my first letter is going to mean, and position number 1 is going to be my atrium. Position number 2 is going to be sensing, no, again, let me take it back. The chamber paced is going to be A or B. So that's the beginning of, or maybe O in some cases, that will be none, or it'll be both atrial and ventricular. So we are pacing, in this case, the atrium, and then the chamber sense, we have none. And then we have on the third position, we have response to sensing is none. It's just, in this case, this particular pacemaker is just pacing the atrium, period. That's what the patient needs. Now, let me erase this and let's go to another sample. Oops. I think I went too far. Now I'm going to do V, A, V, A, and O. So in this case, and I don't even know if that's a real setting, but let's take it. That means the chamber paced is going to be the ventricle. That means the atria is not being paced, right? Just the ventricle. Now, the ventricle is going to pace because the atrium is going to be sensed. So this pacemaker is going to sense the ventricular conduction, the atrial conduction into the ventricle, because the ventricle cannot receive it. On this particular case, the ventricle needs help. So the atrium is going to be sensed, and then the response to sensing will be none. And I'm pretty sure it will be best a T or triggered. So this is how are we going to be reading the letters or the MBG code on the pacemakers. We also have another type, which let's go ahead and do it here because it does exist. It's a dual chamber paced, and it's going to be dual sensed, and then is going to be triggered. So this patient needs dual chamber paced. So atrium and ventricle are going to be paced. Both atrium and ventricle are going to be sensed. So that means when the pacemaker does not receive any sensing or any electrical signal, is going to then act. And then the T is triggered. So this is a response to the sensing. What it's going to do is going to be triggered in this case. I'm pretty sure somebody who needs this pacemaker is kind of needs a lot of help, right? Somebody asked in class, how long does a pacemaker last? Well, it depends. How much am I using this? How much time is sense? Because if the heart rate is going fine, is not needing any support or rarely support or once in a while, and then the pacemaker battery is going to last longer. Now, if it's constantly, especially the dual ones, if it's constantly sensing and pacing and responding, then we're going to have, we're going to use the battery a little bit longer. Now let's take a look at how are we going to see an EKG with the chamber spaced. The top one here, the top image, this is atrial pacing. And what we're going to see here is this little marks right here. This is going to give it away that it's a pacemaker. This is an atrial pacer. And you can see here, right, because the pacemaker is making the atria go. The second one, we do have a ventricular sensing, and you can see here also the pattern here, right? We can see here, and then the ventricular contraction happens. There is no, it is not missing. You will see when you see the strips like that, they're going to be like so steady, and it's so weird because we're used to see, you know, how the heart rate variables a little bit during the cases and such. But when you see a pacemaker patient, is going to look like the strip is going to be nice and cohesive the whole time. And then on the bottom, we do have a dual chamber pacing. As you can see here, we have the two markers, one for atria and one for ventricle, atria, ventricle. And that's what we're looking at lead 2 says here, but this is what dual chamber pacing looks like. And again, you're going to see all kind of things when you see pacemaker or devices that are going to be, we're going to be able to recognize in the cath lab or an EP, depending on where you are doing your practice. Okay, well, that's it for today. Make sure to read chapter 4 of your book so you can read more about blocks. And also I have a lot of resources on your modules. Please go over the material that I gave you, the recognition, the packet that I gave you to recognize. I hope this this small class or lecture helps you go through that